Anyone? Any question here and there? Any burning question? No? All right. So let's keep going. So for signouts, I actually got this from Ogo, our current chief, and we'll just like optimize it with a couple of stuff. So it's actually a dot phrase that I have. I'm not sure if I share with a couple of you guys, but I will send it to you. So basically, whenever I put the sign out, I have like a dot phrase at the bottom of it. Your sign outs doesn't need to be like extended. You just mention like one liner, then the one or two active problems, and then you need to put these things. Most of our COVID people, you need to mention what is the oxygen requirement, and then lines, if anything, need to be placed. So the night team will know like if this patient will require a line, so they can prepare and ask for help or like put the line themselves. Any pressors, and then the sedation, which is usually what the night team usually like adjusting if the patient is desatting. So they need to know what sedation is the patient on, so they can adjust from that. Any fluids running, if like a hyponatremia patient and there is like a 75, like 2% normal saline running or something like that. Any antibiotics in case the patient like spiked the fever and there is need to broaden from there. And the GCS, so sometimes like a drop in the GCS might indicate like a worsening of the situation. I need some workup. Any neurodeficits, so sometimes the patient is like right-sided is weak. So this is the baseline. We don't freak out in the middle of the night about like a new stroke. So, and the important thing is as trends. Sometimes like you need to follow sodium every 2 hours or like following lactic acid. So the big ones that we usually trend are tropes in a septic patient, lactic acid in a septic patient, troponin. Sometimes most like there's a lot of type 2 MI, but there is like a legit end STEMIs that we see. So we still follow some tropes. Sodium checks, these kind of stuff that we need to trend overnight, and we need to tell the night team about. So that is for the sign-outs. Now we'll talk about new admissions. Then we'll talk about COVID specifics. So